Today I will show you an exercise that is the best thing you can do if you have any kind of lower back pain. But if you're dealing with spinal injury like bulging disc, herniated disc, and you feel all the sciatica symptoms in your hips, buttocks, or down to your legs, this is for you. Listen, this is golden. Yo, my name is Mike, and in January 2025 I was diagnosed with L4, L5 disc bulge, L5, S1 disc herniation. At my worst, I was limping. My complete left leg was numb. I needed help to sit down, stand up, put on shoes, put on socks. I was done. I was told by multiple different doctors and specialists that I won't be the same again, that this is who I am now, that I should base my life around this injury. No. And today we will be using a back extension machine, so-called a Roman chair. It's the best thing you can get if you have any kind of lower back pain, or if you're dealing with disc bulge, herniation and sciatica and you want to rebuild your back to the point you will be able to be normal again. One more thing, if you don't have this at the beginning, you even won't be able to do this if you're severely injured like I was, You can do it on a couch. I will explain it later, you will understand. But first of all, let's start. Now, when you go on this Roman chair or back extension machine, when you go on top, now this is the perfect size set for me, below my hips, But at the beginning, you should be starting super high. So you put as low as possible strain on your lower back. And I mean by that, you should unscrew this, put it much higher, put it here, and start here. Start here, below your chest. And even you can use those levers at the beginning to hold yourself and just do small daily holds, just holds. And slowly progress over months. If you're dealing with spinal injury like bulging disc, herniated disc, or multiple of those, it will take you months and months and months. So do not rush it, because you can flare up and you can fall back again 2-3 weeks, month. You know how it goes, First, we start super high, like I told you. Then, over the months, we slowly progress. The first progression will be just holds and lowering these pads. So you get to the point that you have your pads below your hips. And now, how you do this? When you start, you go on the back extension machine or Roman chair and you look at my belly. You suck in your belly, and you're squeezing just to activate a little bit of your glutes. So that's it. Squeezing glutes, sucking in belly, and just holding it there. That's it. Do this at the beginning. Do this, for example, 50 seconds, 20 seconds, and rest. Wait for the next day. Never assess the damage. Whenever you're dealing with spinal injury, like bulging disc, herniated disc, and all the sciatica symptoms, never assess the damage or your body's response the same day, because nerves react with delay. You get worse symptoms in the evening or the next day, so stop. Do, let's say, 20 seconds, 30 seconds of hold, super high pad, and wait for 24 hours. If tomorrow you're feeling good, the symptoms are the same, or better, just that it did not increase the symptoms. If the symptoms are the same, that's it. We want this. This means you're deliberately training the muscle group and you're not increasing the pain. This is good. So later down the line, when we strengthen complete posterior chain, which includes glute, core, hamstrings, and your spinal erectors, we put the load off your spine, because the muscles take the load off your spine, because they're stronger and stronger each month. And this will slowly retract all the symptoms you have, because you have a lumbar spine disc issue. The disc pushes out, press on your spinal nerve that is traveling down to your legs. That's why you feel all those sensations in your hips, buttocks, or down to your legs. Now listen, this is the first progression. We are first doing holds. Later down the line, we will introduce reps, slow. But I mean slowly, First, you get to this point that you can hold with a pad below your hips. Like this. We are having a core engaged, sucking in belly, squeezing a little bit of glutes, and that's it. And when you're comfortable holding this position with a pad below your hips for, let's say, for example, minute and a half, then you can hold those levers and start, I will show you, and start bending, but I mean slowly. First of all, slow movements like this. You know what I mean? Like this. And later down the line, slowly, you will be able to do deeper and deeper. The stiffness will slowly go away, the muscles will get stronger, and you will get better and better. But this is small, slow steps each day towards pain-free life. Healing a spinal injury takes months. Remember that. This is like when you go to the gym. First few months you don't see nothing. Later down the line it compounds. And it's the same with a spinal injury. Exactly the same. So just trust the process. Keep on doing the things that are correct to do and you're good to go. In a matter of, let's say, 6 months, you will be a different person. Now listen, if any of you need my help actually, let me know. Send me a DM on my Instagram, or I will give you a link below this video. You can book a call, you can book a one-on-one assessment call with me. Then we're gonna see where you are, what's happening with your body, and if we decide we're gonna work together, that's it, we go from there. Now let's continue. When you can start bending, this is good. You're introducing reps, you're introducing mobility, you're bending. Now, but I don't mean bending. You're bending from your hips, not from your lower back. Again, you suck in your belly, you activate your glutes, and you're bending down. You're bending down. You will feel stretch in your hamstrings, and this is what we want. Go down slowly, hold for half a second at the bottom, and slowly go up. You know, we want clean reps. We don't want any rushing, none of that. We want clean, slow reps. Slow down, hold for a second, slow up. And when you manage this without holding yourself, you know, you're building complete posterior chain. You're actually targeting the muscles that are super weak, that will help you take the load off your spine. Later down the line, you will introduce weight. Let me show you, for example. And you will do reps with the weight. And just later down the line, you will slowly progress to the point you will be able to put so much weight to your complete posterior chain on your lower back that you will be bulletproof. You will see. It will take you months, a lot of time, but it will be done. If you will persist, if you won't give up, you will get to the point you will be stronger than you ever were. You will be able to lift weights, run, jump, sprint, be athletic, be normal. Of course, there is so much more. There is so many exercises you will have to do with this, you know. This is just one small part of it, of healing your spinal injury, but it is a great start, you know. And yes, one more thing, if you don't have the Roman chair or back extension machine, you can use normal couch. Just pretend, let's say for example, I hope you can see me now because my camera is there. You can just use the couch. Let's say if your couch is to here, you know, that's nice. You just step a small step back or a half step back and just lean on your couch and do the same movement. You know, you will be in this position without holding to something. You will be in this position, activate your glutes, suck in your belly and just hold in this position, and you will feel later, in a matter of half minute and a half, you will feel your lower back working. You will feel the muscles, you know, you will feel the blood flow there. And this is what we want, you know. We want to deliver additional oxygen and nutrients to the body part which needs healing. In the meantime, we are strengthening complete posterior chain. This is the best thing you can do for your lower back. And if you're dealing with any kind of back pain, any kind of lower back pain, this is the solution for you, you know. You just have to be consistent, and that's it. So, if any of you are dealing with a spinal injury like bulging disc, herniated disc, and you feel all the sciatica symptoms in your hips, buttocks, or down to your legs, listen, you can fully recover with my help and my approach. I done it myself. I help many other guys do the same. So, if you feel stuck, if you feel that you cannot progress, you let's say for example, some days you feel better, then you do something, and you feel worse, you fall back again, hit me up on Instagram, send me a DM, or click the link below, book a one-on-one assessment call with me. I can help you out. Good luck, guys. You can do it too.